Cool. So obviously you're complaining about neck stiffness, pain, achiness. Does this affect your productivity? Do you get any sort of headaches, any tiredness from it?
You know, sometimes you feel a lot of these things, tiredness, headaches, but you don't relate them to.
You don't associate,
Yeah. But I definitely have a tight neck and overall tightness in like everything here.
Anything above your head, which we obviously established from your testing last time. So our aim is to move away from the back and focus a little bit more on the upper, to make sure that we improve the natural passive posture of your neck, but also active posture. So you're training a lot as well recently. So your head posture when training is also really important to make sure that you get good loading through your shoulders. If the neck posture can also heavily affect the shoulder blades and also the ball and socket joint. So our aim today is just to check your range of motion. Have you had any referred pain going down your arms?
No, nothing.
No tingling, numbness, no effects in terms of strength from left to right. Any big discrepancies?
My left arm is more vascular and stronger and bigger than my right arm.
But do you find that you're a lot more stable through your left side than your right?
Stability-wise, I don't think there's much of a difference, but you can see clear development differences in left and right.
Okay, cool. So we'll double check that in terms of your nerve route from the cervical spine as well. So your myotones, which is your supply of your nerves from the center nervous system to your muscles. So if there's any compromises on that right hand side, it could affect your ability to grow on that right side.
I did do a reflex hammer on both sides and it did look the same.
Okay.
But you might want to check it, and that was a long time ago.
It's also about your symptoms that we will double check, okay? So the first thing we're gonna do is check your basic range of motions. So we're gonna sit nice and tall for us. So we're gonna go for as low as possible neck flexion. So you're gonna look down as far as you can. How does that feel? Any discomfort, any tension?
No.
Okay. So what we're gonna do is just check your natural motions of neck flexion, so all the way down. Good. Any sensations there? Do you feel any pulling through the mid-back, any discomfort into the upper?
No.
Okay, so let's go all the way down again. So we're roughly about an inch from chin to chest. From here, you're gonna look all the way up into the ceiling. Very good. How does that feel?
Good.
Any compression, any discomfort into the lower back, into the mid? Okay, let's go a little bit further again. I'm gonna add a little bit more range. How does that feel there?
I can feel the cervical, like
compression.
Yeah.
So a little bit of discomfort into the middle, which high extension.
Is it the vertebrae that are closing?
Yeah, so that could be because they should glide away from each other. However, if you're a bit kyphotic through here, it creates a block.
Yeah.
So as when you extend, there should be an element of thoracic extension together to move. So then what we're going to do is just special test, just lean to one side. How does that feel?
Okay.
Does this recreate any of your symptoms, any pain, any referral down the arms?
No pain.
Very good. And then from here, let's go on to the other side. Does it feel pinchy? Any discomfort?
Left side is pinchy, yeah.
Left side is pinchy.
Left side here.
Yep. Onto that sternocleidomastoid. Okay, perfect. From here, you're going to look as far as you can towards the left, as far as you can towards the right. How does that feel?
Good.
Range of motion seems okay. The quality of movement seems generally equal between left and right. Looking straight again. Let's go left ear to left shoulder, side bend. Very good. And then right ear to right shoulder, side bend. Very good. Okay, and how does that feel?
Okay, yeah.
So the quality of movement generally isn't too bad, but there is a lot of tissue tone in the upper, which is restricting thoracic movement. And if you look side on, you can see that there is a lot of kyphosis, which then puts a lot of pressure onto the cervical spine. So when palpating, how does that feel on your C7 there?
I can just feel it on the bone.
Yep, just feels like pressure. Doesn't feel discomfort. There's no bruising or how does that feel there?
No, I just feel the bone.
Okay. All of this doesn't feel uncomfortable or any discomfort?
Tightness in my mid-back.
So only tightnesses, but no discomfort when palpating. Okay, perfect. So you're going to go arms across your chest. From here, you're going to pivot as far as you can towards the left-hand side. Very good. And you're going to pivot as far as you can towards the right-hand side. Very good. So there's a little bit more range rotating towards the right, but you can feel that you had to push through that resistance. So what we're going to do is address that internal rotated shoulder footersman, okay, which then causes the shoulders to protract and elevate, which then shortens the levator scap and can trigger tightnesses into the upper. So the first thing we're going to attack is all the tissue tone into this upper back first.
Can I attack it?
Yeah, we're going to attack it with a bit of soft tissue and a little bit of activation through training. So we're going to do a little bit of percussion first to desensitize the skin, and then from there we're going to work on some fascial release. Okay, so nice and relaxed for me. That's it. So just mainly working in the upper trap. What's your training split at the moment?
Monday is upper, Tuesday is legs, Wednesday is do nothing, Thursday is upper, Wednesday is circuits, Saturday is upper legs, arms, and then Sunday is sometimes some movement, but not a lot of cardio right now. I should be doing more.
So roughly around 4 to 5 training days, 2 days off, roughly,
Yeah.
give or take. Yeah. Okay. And what's your goals? What are you trying to aim at the moment?
I'm just training to get fitness up and then gain the muscle back that I lost.
Okay.
So I've just been trying to do a bit more weight training.
Okay, cool. So firstly, we're going to work on this posterior fascial line. So we're going to work on that posterior line all the way down into the mid-back and then into that upper shoulder. So we're just going to work on this upper portion. You're going to do, stay nice and relaxed for me. Just let the weight of your head drop down. Perfect, that's it. What are you feeling currently now, Isman? How does this feel as a treatment? Because there's a lot of misconception. There's the outcome from this treatment can look quite daunting and painful. How does this feel?
Surprisingly, it just feels like you're on the muscle, inside the muscle, not on the skin.
So it doesn't feel particularly uncomfortable though, does it? It doesn't feel
Not
sharp?
No.
Okay, good. So from here, we're going to use this hand and you're going to grab the opposite shoulder. Good. This helps pull and you're going to relax the shoulder down for me. You're going to let the rest of your neck just drop down. Perfect. So by pulling the shoulder out of the way, yeah, so we're going to hit, so you can feel the adhesions that I'm running over. It almost feels like gravel underneath the skin. So there's going to be tightnesses. As you can see, Usman's been training a lot through his back. His rhomboids, his lower traps, mid traps are very adhesive. And you can feel it from the attachment onto this medial shoulder blade just here. You can feel that there, can't you, Usman? Yeah. Just deep breath in for me. And all the way out. That's it. How long have I been working on your shoulder for?
A couple of minutes.
Yeah, a couple of minutes, okay? So we're going to retest now just from doing that right hand side. Let's go neck all the way down. How does that feel?
The right side seems
much looser, right? Because initially to start with, there is tightnesses, there is a lot of restrictions, but Usman refers that as his normal. So what we're going to do is show him what normal should feel like. And already on that right hand side, it's a lot more freer, isn't it?
Yeah.
Yeah, perfect.
A lot, yeah.
Amazing. So what we're going to do is replicate that on the left. Okay, you can feel it all up into the cervical spine. Have you done much recovery? What type of recovery work do you do? Other than nutrition and hydration?
Nothing. Just
No contrast bathing, no heat treatments?
Oh, nothing. I'm going to become a professional biohacker when I'm rich.
A professional
Biohacker. When I get the money, then my job's going to be biohacking.
Yeah, just hold that.
I'm going to become Brian Johnson.
Nice, nice. Just let the shoulder relax and then let the head drop to one side. Perfect, there we go. Deep breath in and then all the way out. Is this ticklish? Is it sore?
No, it feels good.
Okay, amazing, amazing. So we're trying to work in multiple directions, working along the fibers of the tissues and working against to break down the scar tissue and then flushing it out. Okay, let's sit back up through the mid-back. So the idea is we're going to try and isolate the neck first and then integrate the cervical spine with the thoracic. So from here, you're going to sit nice and tall. You're going to go head down for me, all the way down as far as you can. Perfect. How does that feel?
Good.
Good. And then all the way up into the ceiling.
The bones don't touch.
Not as much. However, you can see the bulging SEM here, and the scalenes, we're going to work along that anterior aspect of the neck after.
Those are spasmed before.
Yeah, and the reason why they're spasming is because that deviation of your head going forward. So Usman's head, if you come from the side, you can see that naturally after a while of working at the desk, you can get that head forward posture. The thoracic probably rounds forward a little bit more as well, which puts a lot of pressure through that anterior aspect. And that's why you've started to get a little bit of displacement of your C7 and T1 joint, okay? So when you look down, You see how prominent these joints are. So we want the cervical spine and thoracic to move freely together, okay? So this is also an example of the outcome from the treatment. So you can see the speckleness on the upper shoulder. So this isn't due to how hard I was going with the therapy. It's definitely more to do with where the adhesion's sitting, because there was no pain at all, was there? No? Amazing, amazing. So from here, what we're going to do is going to get Usman to lay onto his back. We're going to get a little bit deeper into that mid thoracic, but also his cervical spine. So even just laying down, you can see the position of Usman's neck. So this should be comfortable to be able to lay, just let your head relax for me, in a neutral position. So I actually have to lift Usman's neck up for him to get a neutral position for his cervical spine. So by releasing all the structures from the front and also the upper chest as well, that causes and creates that internal rotation, that will start to free up the neck as well, okay? So I'm going to take the neck, you're going to let the weight of the head drop. Okay, I'm going to grab onto the SEM. It's going to feel a little bit of discomfort, and we're just going to hold there, okay? You're going to breathe in for me, and let the weight of your head just drop down as you breathe out. Good, just let me start to lengthen. Perfect, there we go. Breathe in again, breathe out. Just let the weight of your head just drop, perfect. How does that feel on the front of your neck?
Relaxed.
Easier, right? There's a lot less tension, doesn't feel like you have to lift the head up to be in the right position. How many pillows do you sleep with, Isma?
I fold one pillow.
One pillow?
Yeah, and it looks like a mess.
Because one feather pillow you can mould around your neck, whether you're laying on your side or whether you're laying onto your back. Anything higher is only going to help promote the position of the...
Honestly, I smash my pillows. I fold them up and they look like candy floss.
Breathe all the way out, all the way out, all the way out, and that's it. Let it go, let it go, let it go, let it go, let it go. That's it, good. Breathe all the way out. Okay, we're going to go 2 more. Exhale, 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 exhale. And one last one. Good work, well done, and relax there. Okay. Good, deep breath in. Good, just a touch slower, on the outwards breath, that's it. And you can feel that tension start to dissipate, can't you? Yeah. So our aim and our target for this session is mainly just to prep Usman's body, so then he can reinforce our release with the exercises that he's doing with Billy. So what we want to look at is even just a natural posture of Usman's cervical spine, the way he lays down from when we first started to now. So his ability to be able to drop that chin down, we want him to ideally to be there, okay? So what we're going to do now is we're going to work on a little bit on his upper pec to help release the ability to go into external rotation. When Usman externally rotates his shoulder, his ability to retract becomes easier. So what we're going to do is I'm going to externally rotate. Now you're going to retract the shoulder blade and depress it, hold it there, and then you're going to hold it there. Now try and do the same on the left-hand side without external rotation. So you're going to hold this and you're going to try and retract and pull down. What can you feel more recruited? Without flaring the rib cage. Pull the rib cage down. That's it. Good. Well done.
Mid-trap.
Mid-trap, yeah? So just breaking down that scar tissue there. So then we're attacking not just a symptomatic area where we think is tight, we're also attacking the areas that are pulling Usman forward to allow him to be able to open out the body. Yeah, you can feel that bicep, don't you? Yeah. Okay, just from doing that for a brief moment, we're going to extend the opposite arm out in the same position. And a little bit higher for me, Usman, on that left side. Yeah, that's it. How does that feel?
Well, the left is falling nice and calm.
Left or right?
The right is falling nice and calm.
So even if you take a video from the top end, you can see that this hand's a little bit lower. So what we're going to do is we're going to replicate on the other side, and I'm also going to get underneath and to release that tissue further. So I'm going to get underneath the pec. Oh my God. Definitely feel that scar tissue there, can't you? And then we're going to go right there. That's it. This is the first point we're going to hold. I'm not going to go any harder than that. I just want you to get used to the pressure. That's it. So we want to get right underneath the pec major, pec minor, and we're going to trigger point from
the deepest, darkest part.
Yeah. It's not as bad as a soul snatcher into the psoas, is it? The psoas is
no,
horrible.
the worst is the lat one.
Lat
From
one?
the front.
Where you go through here. Yeah. So I'll definitely say even just the atrophy that Usman is feeling into the pec probably relates to his old injury of his pec tear. So the role of the muscle is to flex the elbow, but also to flex the shoulder. So if it's having to do more to help stabilize the anterior shoulder, what you find is the growth and the focus on the muscle when training is reduced. Do you find it's fatigued quicker?
Yeah, it hardly even grows. It hardly does
Yeah.
anything. It's just a dead muscle.
So even just here, Alex, if you look, so if I run my finger across, you can feel those adhesions that I'm running across. You can see it. Where the blade isn't gliding smoothly, it's getting caught every single time. Bang, 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 bang there. So what we're going to do is lightly work on those until we reduce the adhesions. And that naturally will allow the pec to open up into extension. So then when you're pressing, you should be able to get lower. So all your press ups now, I want you to do in a deficit position, either on dumbbells or parallettes,
Okay.
just so you can get more range into it. The more you rip the fascia and the muscles, the more it's going to grow. Yeah, so today's main focus is a lot of it is prepping the body through soft tissue, but the idea is this isn't the end of our treatment. Our treatment will then combine with some active corrective exercises that helps with repositioning the shoulder blade into optimal position. That will then open up the shoulder joint. Do you get any pinching into your shoulder when pressing above your head?
No,
No?
I just do less range of motion.
Yeah, so you're going to do more of an incline chest press, don't you? Yeah. Anything vertical above your head you don't really do much of?
I do started doing a Viking press now.
Okay. Viking press is still not quite fully vertical. Are you doing it on that unit? That massive unit? Yeah. So after this, what we're going to do is just mainly focus on, just to finish off, the different structures. So we've attacked the superficial layers of fascia. Then we attack the muscle bulk for the upper trap. Then we're going to hit then the joints itself. So then we're going to look at manipulating the cervical spine and mid-thoracic and pairing up the movement between the two. That's our main target for Usman's end of the session. And then what we're going to do is sit up, retest, and see how he feels. And we're going to combine that with the work he's doing with Billy to incorporate some corrective exercise to reinforce what we've done in the clinic. We've finished off on the superficial tissue and muscle tissues. Now we're going to target more the joints. So we're going to have a look at your cervical spine, and we're going to work down into your mid-thoracic, and then we're going to get you up and retest. So we're just going to check the quality of the movements. Okay, just let the whole head rest for me, Usman. That's it.
Oh, sorry. It's pressed a bit there.
That's it, yeah, you can see all of that. So just let your head rest. So I'm going to do a little bit more soft tissue work because all the work through the scalenes is still quite tight. Let it breathe for me, Usman, that's it. Let it drop, good. Let it go. 2. And this is why Usman every so often gets spasmed through that lateral neck, because even just a light pressure, you can see how his body is responding. There's a lot of tension sitting deep down into the neck. There you go. Breathe in for me, and you're going to exhale all the way